Bismillahirrahmanirrahim. Quote of the day: if you cannot do great things, do small things in a great way. Today, the topic of my presentation is hepatitis B, and I am presenting it under supervision of my professor, Dr. Sarah Afzal. Learning outlines of my presentation are introduction, global trends, epidemiological triad, levels of prevention, recent updates, and MCQs in the end. Learning outcomes. By the end of this presentation, participants would be able to describe the clinical features, complications, prevention, and control of hepatitis B. This is a case scenario. A 20-year-old female presents to the clinic with a 10-day history of flu-like symptoms, including anorexia and malaise. She does not report any pertinent prior medical history or surgeries. She takes no medications. Her family history is non-contributing. She reports no sick contacts. She has got multiple tattoos and skin piercing from local shops 6 months back. She hasn't traveled outside the US in the past 5 years. On physical examination, she is alert and oriented and no acute distress. Her vital signs are also normal. Her extraocular muscles are intact. Mild scleral icterus is noted. Heart sounds are regular, rate and rhythm without murmurs. Lungs are clear to auscultation. The abdomen is soft and non-tender, except the liver is tender when palpating extends 8 cm below the costal margin with a smooth edge. So the differential diagnosis for this case scenario, we have autoimmune hepatitis. It could be hepatitis A, B, D, E, drug-induced liver injury, hemochromatosis, hepatocellular carcinoma, Wilson's disease. So it points more towards hepatitis B if we see the history. Let's see ahead that how it would be. Hepatitis B. It is a potentially life-threatening liver infection caused by hepatitis B virus. It is a major global health problem. It can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. Global scenario. More than 1/3 of world's population has been infected. WHO estimates that 296 million people were living with chronic hepatitis B infection in 2019, with 1.5 million new infections each year. In 2019, hepatitis B resulted in an estimated 8 to 0,000 deaths, mostly from cirrhosis and hepatocellular carcinoma. The burden of hepatitis B infection is highest in WHO Western Pacific regions and African regions, where 116 million and 81 million people respectively are chronically infected. 60 million are affected in Eastern Mediterranean region, 80 million people in Southeast Asian region, then 14 million in European regions, and 5 million in the regions of America. This is the picture of a global map where we can see very well the global prevalence in different continents, where greater prevalence, that is 5 to 7%, is seen in sub-Saharan Africa and Asian regions, and more in the greater than 8% is seen in this area of the Africa. Now, epidemiological triad. First is agent. Agent is causative agent is hepatitis B virus, which is double-stranded DNA genome enveloped, and it is a part of hepatinovirus family. And the virus contains 3 important hepatitis B virus antigens. That is hepatitis B S antigen, which is a surface antigen, and it is first to be detected in pairs during incubation period. Then is hepatitis core antigen. Then is hepatitis B E antigen, which is a marker of virus replication infectivity. Then comes host factors. This is age. All ages are susceptible, and highest prevalence is found in age of 20 to 40 years. And it is equally prevalent in both genders. And high-risk groups are recipients of blood transfusion, surgeons, healthcare workers, laboratory personnel, homosexuals, percutaneous drug abusers. Environment factors. Cases are present in whole years and season, and the main contributing factors are poor and non-educated people. Chain of transmission. The reservoirs include cases and the carriers in which hepatitis B antigen is detected for more than 9 months, and infective material consists of contaminated blood, blood secretion, semen, saliva. Mode of transmission. There are three modes: parental route, vertical transmission, sexual transmission. In parental route, we have infected blood and blood products, contaminated syringes, pricks of skin, dental procedures, tattooing and piercing. And vertical transmission is that it can be transmitted from a pregnant mother to her fetus. Now, concentration of hepatitis B virus in various body fluid. It is high in blood, serum, won't exceed the moderate concentration is seen in semen, vaginal fluid, and saliva, and the lowest concentrations are found in urine, feces, sweat, tears, breast milk. So, since it is found more in serum, so it is also called serum hepatitis. Initially, it was called serum hepatitis. Now, this is an example of that how infectious agent, that is hepatitis B virus, is transmitted from a reservoir to susceptible host. For example, here reservoir is chronic hepatitis B virus carrier. Then this virus transmitted through it is exited through bloodstream, then via vehicle like surgical instrument it enters through a cut on a service provider's hand, and then it infects the susceptible host, which is usually an infected service provider. Now, who is at risk for hepatitis B? Although anyone can get hepatitis B, but these people are at greater risk. Infants born to mothers with hepatitis B, people who inject drugs or share needles, syringes, and other types of drug equipment, and people having sexual contact with the people with hepatitis B, men having contact with men, people who live with someone who has hepatitis B, and healthcare and public safety workers exposed to blood on the job, and lastly, people on dialysis. Infectivity period. Incubation period is very long, usually from 45 to 100 days, and period of communicability is several months depending upon the presence of hepatitis B as antigen in the blood of the infected person. Clinical features. These vary as there are two types of viral hepatitis B, that is acute and chronic. Acute lasts for less than 6 months, and it characterized by nausea, vomiting, right upper quadrant pain, and on investigation there is marked levels of bilirubin. You have jaundice, pruritus, dark urine, clay colored stools, and hepatomegaly on physical examination. And the other type is chronic, which lasts for more than 6 months, and it is usually asymptomatic, but however it is presented as fever, fatigue, and loss of appetite. Extrahepatic symptoms are arthralgias and skin rashes. Outcome of hepatitis B infection. Here there is acute infection, then 60 to 65% of the cases, these are subclinical cases, which are 100% they are recovered, and 20 to 25% of the acute infection they result into acute hepatitis, and 99% of these patients they are recovered, while less than 1% are characterized by fulminant hepatitis and death ultimately. And 5 to 10% of the people with acute infection they are healthy carrier, while 4% they are having persistent infection, and 67 to 90% of these people are recovered, while 10 to 33% of these they are converted into chronic hepatitis, and 20 to 50% of the people with chronic hepatitis they are presented as cirrhosis, and 10% of them are they can be affected as hepatocellular carcinoma and ultimately death. Complications. Having a chronic hepatitis B virus infection can lead to serious complications such as cirrhosis, liver cancer, liver failure, or fulminant hepatitis, and other conditions like people with chronic hepatitis B may develop kidney disease or inflammation of blood vessels. Prevention. Primary prevention, it includes health promotion, like health promotion that is lead a healthy lifestyle, using of sterile syringes, avoid stress, observe the rules of anti-epidemic regime, do not do piercing, tattoos in questionable places, follow the rules of personal hygiene, and health promotion on vaccination awareness, and using some protective measures while having sex. World Hepatitis Day, it is celebrated every year on 28th of July to raise awareness of the problem and what needs to be done for prevention and control of this viral hepatitis. Then comes specific protection. It is done by active immunization and passive immunization. Active immunization, we had plasma-derived vaccine. Then it is now replaced by recombinant DNA vaccine. In passive immunization, we have hepatitis B immunoglobulins used for post-exposure prophylaxis. Hepatitis B vaccination. The hepatitis B vaccine offers excellent protection against hepatitis B virus. The vaccine is safe and highly effective. It consists of 3 doses of vaccine over the course of 6 months, and protection lasts for 20 years to life. The first hepatitis B vaccine to become available commercially in 1982 consisted of hepatitis B S antigen purified from the plasma of persons with chronic hepatitis B infection. That is, it was plasma-derived vaccine. But now it has been replaced by recombinant vaccines that are free of any concerns associated with human blood products. Recombinant DNA vaccine, it was introduced in 1986 in USA. It has replaced plasma-derived vaccine. It is cost-effective, available as monovalent or combined vaccines. And this is made without any human blood or blood products or any other substances of human origin. It cannot give you the hepatitis B virus or HIV. And its route is IM, upper arm into the deltoid muscle or the anterolateral aspect of thigh, and not in the buttocks. Hepatitis B vaccine recommendations. Groups that the CDC recommends should definitely receive the hepatitis B vaccine. These are all infants beginning at birth, children aged less than 19 years who have not been vaccinated previously, susceptible sexual partners of hepatitis B positive persons, and persons receiving evaluation of treatment of a sexually transmitted diseases, men having sexual contact with men, injection drug users, susceptible household contact of hepatitis B positive persons, healthcare and public safety workers at risk for exposure to blood, persons having end-stage renal disease, including pre-dialysis, hemodialysis, residents and staff of facilities for developmentally disabled persons, travelers to and families adopting from countries where hepatitis B is common, that is Asia and Africa, and persons with chronic liver disease other than hepatitis like cirrhosis, fatty liver disease, persons with hepatitis C infection, persons with HIV infection, and adults with diabetes aged 19 to 59 years. So these all groups, they are recommended by CDC to get vaccination of hepatitis B. 3-dose hepatitis B vaccine schedule. First shot, it is given at any time, but newborn should receive the disease in the delivery room. Second shot, it is given at least 1 month after the first shot. Third shot, at least 4 months or 16 weeks after the first shot and at least 2 months after the second shot. Infant should be a minimum of 24 weeks old at the time of the third shot. So if we see our API schedule, we can see that hepatitis B virus, it is given with other vaccines, that is as pentavalent vaccine, and it is given at 16th weeks and 10th weeks and 14 weeks of the neonates. Then comes 2-dose hepatitis B vaccine schedule for adults. In November 2017, a vaccine was approved by the FDA for use in US. Heplisaf is a 2-dose vaccine approved for use in adults aged 18 and older. The vaccine is administered as 2 doses given 1 month apart. Effectiveness of vaccine. Following the primary course of 3 vaccinations, a blood test may be taken after an interval of 1 to 4 months to establish if there has been an adequate response. And this is seen by the detection of anti-hepatitis B surface antigen antibody level, and it should be over 100 units per ml. Such a full response occurs in about 85 to 90% of individuals. Hepatitis B vaccination in pregnancy. Pregnancy is not a contraindication to vaccination. The vaccine carries no known risk to the developing fetus. The hepatitis B vaccine is recommended for pregnant people who are at risk for acquiring hepatitis B during pregnancy, for example, due to living with people infected with hepatitis B, and for people who started the vaccine series before getting pregnant. Passive immunization. Hepatitis B immunoglobulins is a human immunoglobulin that is used to prevent the development of hepatitis B and used for the treatment of acute exposure to hepatitis B S antigen. It is indicated as a post-exposure prophylaxis for people at risk to develop hepatitis B because they have been recently exposed to body fluids of individuals who have hepatitis B. This includes babies of mothers with hepatitis B, sexual partners, health workers, police and fire workers, and morticians. It is given by either IM or IV route depending upon the preparation. Concomitant vaccination. Hepatitis B immunoglobulin should be given within 14 days of exposure to the hepatitis B virus. The half-life of these globulins is about 3 weeks. In lieu of a booster administration of hepatitis B immunoglobulins, hepatitis B vaccination is initiated at the time of the initial hepatitis B immunoglobulin administration to provide a long-term protection. Combined active and passive immunization is advised in following cases: newborns of hepatitis B S antigen positive mother, percutaneous exposure, sexual exposure, recurrent hepatitis B infection. And the time of hepatitis B immunoglobulins, that is passive immunization, is from 6 hours to maximum 48 hours, and dose is 0.05 to 0.07 ml per kg body weight. So this is the global immunization coverage from 1918 to 2019. And the third dose of hepatitis B coverage in infants is 85% in 2019. Then comes a secondary level of prevention. It consists of early diagnosis, which is done through raised level of AST and ALT, raised level of bilirubin, serological markers, raised prothrombin time. This is the interpretation of serological markers: hepatitis B S antigen, anti-hepatitis B, C, IgM, anti-HBC, anti-HBs antigen. If all of these markers are negative, then the interpretation is that a person is susceptible to HBV infection. If only anti-HBC, that is core antibody, it is positive, then it shows that the person is immune either due to natural hepatitis B infection. And anti-HBs and anti-HBC, if these are positive, that is a person is immune to natural hepatitis B infection. But if only anti-hepatitis B as antigen is positive, shows that the person is immune due to hepatitis B vaccination. If hepatitis B S antigen, anti-HBC, IgM, anti-HBC, these are positive, it shows acute hepatitis B virus infection. While if hepatitis B S antigen, anti-HBC, these two are positive, while IgM, anti-HBC is negative, or we have IgG, anti-HBC, then it shows chronic hepatitis B infection. And if anti-HBC is positive only, then the interpretation is unclear. There could be 4 possibilities: that either resolved infection, which is most common, or false positive anti-HBC, low level chronic infection, and resolving acute infection. Hepatitis B screening. So these are the 3 main serological markers that are used for screening. So blood test for hepatitis B consists of these 3 screening tests: hepatitis B surface antigen test, which determines whether a person currently has the infection; hepatitis B core antibody test, which determines whether a person has ever been infected; and hepatitis B surface antibody test, which is determined that whether a person has cleared the virus after infection or has been vaccinated and is now immune to future infections. So again, it is a sort of repetition that hepatitis B S antigen, it is present both in acute or chronic infection, and it indicates that the patient is infectious, and sometimes it is transiently detected after vaccination. Then comes hepatitis B E antigen, which is present in both acute or chronic infection, and it indicates ongoing viral replication, and it is a surrogate marker for high HBV DNA levels. Then comes anti-HBs, that is present after successful recovery from hepatitis B infection, and it is also present after successful vaccination. So it indicates immunity, this anti-HBs. And anti-HBC, it appears shortly after the hepatitis B S antigen in acute infection. It indicates previous or current HBV infection. So in susceptible individuals all three markers are negative. In vaccinated people, only anti-HBs positive. In past infection, both anti-HBs and anti-HBC is positive. In acute infection, HBs antigen is positive and IgM anti-HBC is positive. And in chronic infection, hepatitis B antigen is positive and IgG is, anti-HBC is positive. So, which people, groups of people should be screened? So, these are pregnant ladies and anyone who is living with someone who has hepatitis B and having had many sexual partners, and men having contact with men, and anyone having a history of STDs, having HIV, hepatitis C, having a liver enzyme test with unexplained abnormal results, received kidney dialysis, and anyone using illegal injected drugs, or anyone in prison, people who are born in country where hepatitis B is common, like Asia Pacific Islands, and people having parents or adopted children from places where hepatitis B is common. So this is hepatitis B profile. First is in incubation period, which lasts for 4 to 12 weeks. Then comes acute infection, which lasts for 2 to 3 weeks, 2 weeks to 3 months, in which there is a surge in hepatitis B S antigen and hepatitis B E antigen. Then recovery phase occurs, in which there is a rise in anti-HBC and rise in anti-HBC IgM. Now, treatment. In acute hepatitis, usually there is no specific treatment. The patient is asked to have rest, proper nutrition, plenty of fluids. But in severe cases, antiviral drugs or hospital stay is needed to prevent complications. For chronic hepatitis B, these are the two kinds of approved drugs: interferon conventional, interferon alpha, peg interferon alpha 2A. It has a combined antiviral and immunomodulatory effect. Then is nucleoside, nucleotide analogs. We have lamivudine, adifovir, entecavir, telbivudin, tenofovir. These have direct antiviral effect. Pregnancy and hepatitis B. Babies born to a mother with hepatitis B have a greater than 90% chance of developing chronic hepatitis B if they are not properly treated at birth. So it is very important that pregnant women should know the hepatitis B status in order to prevent passing the virus onto their newborn baby during delivery. So if a mother is tested positive for hepatitis B, then the newborn must be given proper prevention immediately in the delivery room, clinic, or bedside. First dose, that is birth dose of hepatitis B vaccine, and the other dose of one dose of hepatitis B immunoglobulin. It is given, and it is the point to note that hepatitis B immunoglobulin, it is recommended by US CDC, but is not recommended by WHO and may not be available in all countries. And what is the most important is to make sure the hepatitis B vaccine birth dose is given as soon as possible in such babies. Recent updates. WHO response. The 74th World Health Assembly in 2021 adopted a previous decision of the Executive Board to request that global health sector strategies on HIV, viral hepatitis, and STDs are developed for period 2022 to 2030 to support countries in achieving the global hepatitis elimination targets under the Sustainable Development Agenda 2030. WHO is working to raise awareness, promote partnerships, and mobilize resources, formulate evidence-based policy and data for action, increase health equalities within the hepatitis response, prevent transmission, and scale up screening, care, and treatment services. And WHO organizes annual World Hepatitis Day campaigns to increase awareness and understanding of viral hepatitis. This is an article on global progress on the elimination of viral hepatitis as a major public health threat. In 2016, the World Health Assembly passed a resolution to eliminate viral hepatitis as a public health threat by 2030. And this study was aimed to examine the status of global viral hepatitis response. In 2017, 135 WHO member states provide viral hepatitis country profile responses. They are home to 87% of the infected population. 62% had a national viral hepatitis plan, and 36% had assigned dedicated funding for implementation. This is another article on hepatitis elimination by 2030, progress and challenges. The aim of this study was to give an update about the progress and challenges to achieving hepatitis elimination by 2030, Progress is, according to the latest data, 87% of infants had received the 3 doses of hepatitis B virus vaccination in the first year of their life, and 46% infants had received a timely birth dose of hepatitis B vaccination. Challenges are there is a strong need to improve blood infection safety. Rates of hepatitis B and C diagnosis are very low. There is a dire need to speed up hepatitis diagnosis and find the missing millions of people living with viral hepatitis. The major hurdle to achieve hepatitis elimination is lack of finances to support viral hepatitis programs. And hepatitis elimination needs strong financial and political commitment, support from civil societies, and support from pharmaceutical and medical companies around the globe. This is the graph to show global vaccination coverage over 2019. And we have seen that it is 85% of for hepatitis B vaccine. MCQs. MCQ number 1. In addition to immunization, the most important means of preventing infection with hepatitis B virus is strict adherence to standard precautions, use of hepatitis B immunoglobulins as a routine treatment after blood exposure, appropriate disinfection of all equipment with the diluted bleach solution, similar antimicrobial agent, heat treating of all the blood products by the blood bank or blood processing center prior to release for transfusion. Yes, A is the right option. MCQ number 2. A mother is hepatitis B as antigen positive at 32 weeks of pregnancy. What should be given to the newborn to prevent neonatal infection? Hepatitis B vaccine only, immunoglobulins, hepatitis B vaccine plus immunoglobulin, or immunoglobulins followed by vaccine 1 month later.
C.
Alpha.
D.
C is the right option. MCQ number 3. The following is or are true of babies born to the hepatitis B positive mothers. If mother is hepatitis B S antigen positive and hepatitis B antigen positive, the baby should receive a dose of hepatitis B immunoglobulins at birth. If mother is hepatitis B S antigen positive, hepatitis B antigen negative, and the baby weighs 1800 grams, the baby should receive immunoglobulins. The first dose of the hepatitis B vaccine should be given within 24 hours of birth. They should be tested for hepatitis B S antigen at 6 months of age. They should be tested for hepatitis B S antigen at 12 months of age.
A.
No, C is the right option. MCQ. A patient's hepatitis B antibody panel is positive for both hepatitis C immunoglobulins and hepatitis S antibodies, but negative for hepatitis B S antigen. The correct interpretation of these results is that the patient is chronically infected with hepatitis B, has never been exposed to hepatitis B virus, has had acute hepatitis B in the past, but the infection has now resolved, has had a chronic case of hepatitis B in the past, but the disease responded to interferon therapy.
C.
Yes, C is the right option.
C.
MCQ number 5. Children and adolescents with hepatitis B are least likely to acquire the infection at birth from infected mother, from fecal-oral transmission from another child, that is horizontal transmission, early childhood, D from sexual transmission.
B. B. B.
So C is the right option. MCQ number 6. Which of the following statement regarding hepatitis B immunoglobulin is not correct? Hepatitis B immunoglobulins contains a high titer of hepatitis B S antibody. Hepatitis B immunoglobulin is prepared from serum of patients who are recovered from hepatitis B. Hepatitis B immunoglobulin is used to provide immediate passive protection to individuals. Hepatitis B immunoglobulin is not recommended to give to newborns whose mother is hepatitis B S antigen positive because their blood already contains hepatitis B S antibody.
D.
Anyone?
B.
B is the right option. MCQ number 7. In addition to being up to date with the routine immunizations, which of the following should be considered for healthcare staff involved in direct patient contact? BCG, hepatitis B, influenza, varicella, hepatitis A.
B.
Yes, B is the right option. MCQ number 8. Mr. Ali, working medical emergency, got pricked while taking sample from hepatitis B positive patient. He got anxious, although had got hepatitis B vaccination completed 2 months back. He got his anti-HBs antigen level to look for his immune status against the virus. Sorry, this is anti-HBs antibodies. The vaccine is effective if the anti-HPS antigen antibodies are dash levels 10 to 100, above 50, above 100, above 200.
C.
Yes, C is the right option. MCQ number 9. The hepatitis B vaccine offers excellent protection against HPV, being safe and highly effective. Which of the following is not true about it? A. It is given as IM or IV in buttocks. Recombinant vaccine has replaced plasma-derived vaccine. Vaccination consists of 3 doses of vaccine over the course of 6 months. Protection lasts for 20 years.
A.
Yes,
A.
right option, yes. MCQ number 10. WHO organizes annual World Hepatitis Day campaigns to increase awareness and understanding of viral hepatitis. It is celebrated every year on 2nd June, 26th June, 5th July, 28th July.
D.
Yes, this is the right option. This is the key of MCQs, and thank you.
Thank you very much, Dr. Meha. Very nice presentation.